In 2010, Robert G. Edwards was awarded the Nobel Prize in Physiology and Medicine for the in vitro fertilization, also known as IVF. Dr. Edwards' motivation was not for fame or fortune, but for helping infertile women. Although it was Edwards' idea, Dr. Steptoe joined later on, but died earlier on into the process. Although these men were denied by the government and many others, they still managed to succeed with the first IVF baby, Louise Brown. After 9 years of trying, John and Leslie Brown, her parents, decided a petri dish baby was their last resort.
IVF is a complex series of procedures used to treat fertility or genetic problems and assist with the conception of a child. During IVF, mature eggs are collected from ovaries and fertilized by sperm in a lab. The fertilized eggs are then implanted into one's uterus, and this cycle could take up to 2 weeks. IVF may be an option for you if you or your partner has any of the following health conditions: fallopian tube damage or blockage, ovulation disorders, premature ovarian failure, endometriosis, uterine fibroids, previous tubal sterilization or removal, impaired sperm production or function, unexplained infertility, a genetic disorder, fertility preservation for cancer or other health conditions. Under any of these conditions, IVF may be the right choice for anyone who has or had problems with conception. If you or your partner has had any of these conditions, your baby could be at a higher risk of having birth defects.
In the beginning, there was failure after failure while attempting to achieve the steps needed for an actual pregnancy. The first hurdle was trying to get a human egg to be fertilized by a human sperm in the lab. Dr. Edwards tried repeatedly for several years to no avail. Meanwhile, Dr. Bavister, his neighbor to the lab, had developed a solution to nourish a hamster sperm while he fertilized his hamster's eggs. Then Dr. Bavister and Dr. Edwards decided to use that same procedure that they used on the hamsters, but with human eggs. After this attempt, they came to the conclusion that it did indeed work. The next step was to get the embryos to grow and divide while still in a petri dish, then transferred to the mother. Even after all of this trouble, 100 attempts later, only one got pregnant, but this was a mishap and occurred only in her fallopian tube instead of her uterus.
Before beginning a cycle of IVF using your own eggs and sperm, you'll need various screenings such as ovarian reserve testing, semen analysis, infectious disease screening, practice embryo transfers, and uterine cavity exams.
IVF includes multiple steps such as ovulation induction, egg and sperm retrieval, fertilization, and embryo transfer. One cycle can take up to 2 weeks, and more than one cycle may be needed. Ovulation induction. It uses synthetic hormones to stimulate your ovaries to provide several eggs. Medications include ovarian stimulation and prevention of premature ovulation, prepare the lining of your uterus, and vaginal ultrasound and blood tests. Egg retrieval. It can be done at a clinic or doctor's office 34 to 36 hours after the final injection. You are sedated and you are given pain medication. May cause cramping, feeling of fullness or pressure. Sperm retrieval. Your partner will provide a sample the morning of your egg retrieval, or he could choose testicular aspiration or donor sperm also can be used. The sperm is then separated from the semen fluid. Fertilization. It can be attempted using methods such as insemination, intracytoplasmic sperm injection or ICSI, assisted hatching, or pre-implantation genetic testing. Embryo transfer. It is done at a doctor's office or clinic 2 to 6 days after egg retrieval.
The chances of birthing a healthy baby after using IVF include maternal age, embryo status, reproductive history, cause of infertility, and lifestyle factors. If you use IVF and you become pregnant, your doctor will refer you to an obstetrician or another pregnancy specialist for prenatal care. If you don't get pregnant, you'll stop taking progesterone.
Thanks to Dr. Edwards and everyone else involved in the IVF, In 2010 alone, 4 million plus test tube babies were recorded in the U.S.